Good afternoon. It is Saturday, October 9th, and welcome to RLM Herbal Ideals, where we take a holistic approach to optimal health. So, this is October, and I will have a newsletter going out for those who wonderfully provided me with their contact information and agreed to participate in my newsletter. Hopefully, I tell you something or give you some information that you find useful, and then you would go on and schedule a consult with me. So, before I get started, I just want to remind everyone that any information that I provide here is for educational purposes only. Please discuss with your primary care provider um, any of the issues that I bring up so that they can guide you appropriately. And I am here to help you, support you in your health journey. I am not a physician or a licensed healthcare practitioner. So again, please take the advice of your healthcare practitioner prior to taking any of my recommendations or starting any new health regime. So it is October, and I wanted to just stop in and give you information about what's going on in October. So October is so you know that every month of the year there is some type of awareness going on. So October has three primary ones. The first one is health literacy. Not too many people speak on that. The second one is breast cancer awareness, where we get this information all the time, and it is important. So I'm going to touch on that for a moment. And then the last one is HIV/AIDS awareness, and I want to just again visit with that as well because while there have been many strides in working with HIV and AIDS infections, um, there's still a lot of work to do, and there currently isn't a medically recognized cure. Okay, so let's talk about health literacy first, and this is not going to be a long video. So, health literacy is being able to understand the medical terminology that health professionals use in addressing any health conditions that you may be subject to. So, one of the things that we have to understand as either holistic providers or healthcare providers in general is to speak in terms that the information is passed and understood. Sometimes healthcare providers kind of forget that and they use medical terminology that is not normal for the individuals that they're treating. So what we want to do is to give you some information other than Google on where to find this, on how to find information on deciphering the medical terms and medical literacy. So additionally, medical literacy will help you have a better understanding and go into procedures and conditions and practices with more understanding and the ability to take the appropriate actions for yourself as well as assist with the family members that you may have in your home. Above all else, health literacy will also help you look at your environment. Here is the holistic approach and determine what are the contributing factors that can adversely affect your health. What are the things that are in your home, in your environment, in your workplace, in your vehicle, things that sometimes we may do to ourselves, such as excess drinking and excess smoking of chemical tobaccos and things like that. Vaping is also one of those issues that we have to address now that do have an impact on our bodies. And when you look up things either on the internet or you go to those of you who still go use the library, that terminology can be very confusing. And one of the things that we want to do is give you the tools to help you identify some of the key terms that are being used. So The best place to do that is to get yourself a very simple a medical dictionary. That way, when you see the documentation that's given to you on your patient summaries. Now, if your healthcare provider doesn't give you a patient summary at the end of your visit, or provide one on a healthcare portal if they use one, a medical Bible, a medical dictionary is going to be your best friend because it's going to actually break down the term, provide its Latin roots to it, and then give you general information on what it pertains to. This helps you treat yourself better and gives you the ability to have informed consent when you speak with your doctor, to have a fuller understanding of the information that they're providing to you. I do know of some people whose doctor said, well, this is okay, but it could be fixed, but they use medical terminology and the person really didn't understand. So they came and said, Tora, what does this mean? So I basically, and I did what I should do. I pulled out a dictionary. There's that I know of, but I pulled out a dictionary and showed them the words and what it broke down to and what it pertains to and how it affects them. They also shared with me their lab work, so I showed them how to look at their lab work, not as much as a snapshot of what happened on their last visit, but also compare it to how things have been going previously. Are they staying within a range that is steady, that is elevated in a normal value? Is it lower than the normal value? Is it around where the normal value is? And are they trending up or are they trending down? So things like cholesterol, the total cholesterol, if it is trending up, then you need to look at your HDL. If your cholesterol, to determine whether or not you are increasing your risk of coronary artery disease, as well as look at things that are trending down. So if your cholesterol is trending down, that is definitely a great thing, but always look in addition to that, your HDL. So if it's trending up, that is good news. You're on a proper path to improving your health, but there are other things that you might need to do to help level out or bring down that cholesterol. So additionally to that, things like they say that you need some iron. So what is iron? Iron is hemoglobin. Where is hemoglobin? It's in your blood. So there are many contributing factors to that as well. I'm not going to get into the specific health conditions that speak to those, but I just want to point out that you do need to either use the library or the internet. And some libraries have books available virtually, so you can read the book on your smartphone, tablet, or computer as opposed to going directly to the store. Check and see if your local library has digital copies that you can do the same and borrow out. And then when it's time to return, it just simply stops, and you can redo it, and you can renew that, online, and then go from there. So these are just a couple of things to consider. Now, with health literacy, it's important to know that so that you can better take a look at the things that are diagnosing and treating breast cancer, as well as HIV and AIDS. I don't know if I'm gonna split them up separately or do them differently, but for both issues, the main thing that we have to look at is, one, your behavioral practices, and two, any family history, especially with breast cancer. And then third, what are the contributing external factors that can put you at higher risk for either of those health conditions? So with both, early detection is the key. Many providers will order, let's say if this is the first time you're seeing them and you are not using, let's say for HIV AIDS, if you've received multiple transfusions, if you have had a partner who has been polyamorous, I'll put it, and you did not know, or you were not practicing prophylaxis, I'll say, those may be reasons for you to have a full STI baseline drawn. So this will tell you where you are right now. And then if you notice situations or symptoms, I should say, that have caused you to question your health, then you at least have a baseline that your doctor can use when they do a medical exam. Similarly with breast cancer, baseline is early detection. Now, what a lot of people don't understand is breast cancer is not only a woman's issue. Some men are also diagnosed with breast cancer. Is it common? No. But does it happen? Yes. And the rates have been increasing. And I don't think the industry knows, but one of the things that's my um, opinion about and my perspective is the amount of hormones that are going in our food supply, not only our meats and proteins, animal-based proteins, but also the phytoestrogens and the pesticides that cause blockers in our bodies that interrupt our balance system, such that the hormones are no longer in balance to keep in check the estrogens or the testosterones that regulate our systems. Those can be contributing factors to breast cancer risk, I'll say. So, women, you should be doing a palpitation on each breast. Take a look in the mirror and look for any abnormalities, swelling, redness, rashes, or anything like that. Men, same thing. If you notice differences from one nipple to the other because you don't necessarily have breasts, but if you see a lump or something, more so men have more muscle tissue, so it might be easier to detect an unfamiliar lump. Those of you who are overweight, then you just might want to try and just palpitate and feel around and see if you feel anything. If you find anything that is possibly abnormal for you, then I would highly recommend that you would go ahead and make an appointment with your healthcare provider to do further testing to determine what that abnormal lump may be. Okay? Um, Additionally, let's say if you're just not feeling yourself, both of them, if you're fatigued when you normally have energy, look for those signs to determine what is not right. Okay? And look for those things. Now, for both situations, your providers will draw blood work, order tests, either digital tests such as mammography or MRIs or something like that to examine the breast tissue. If there is blood work, they would be looking for certain types of blood cells and your blood counts, and it will help them determine whether or not further testing is needed, or they're just going to monitor you and your symptoms over a period of time. So please be aware that these things are crucial, and they do help us help you. And when I say us, I include our holistic practitioners. Now, how do we help ourselves when we're doing this? The first thing we want to do is ensure our body is in the best condition it can be. How do we do that? We look at our diet. We look at how we eat, I should say, not so much diet. We look at how we eat. We look at what type of activities. We look at our overall condition. If you say, well, you know what, I can't get out and I can't run and I don't want to walk and my joints hurts, the best thing I can advise for that, for getting some exercise, is yoga and Pilates. These are very low impact um, ways to exercise. They help you with stretching out your joints. They help you with strengthening your muscles, stretching your ligaments, boosting your immune system. And you would be surprised when you're done with a yoga or Pilates session, you will know because you feel tired, you feel fatigued. And if it's your first time going, you will likely wake up the next day with some soreness. That means you've actually put some exertion on your muscles that is not normally experienced. So, yes, you have exercised, and it is an amazing feeling. This type of exercise is slow and gradual. So if you have, let's say, a heart condition, again, your heart rate will only rise, will not rise quickly. It will rise slowly in a controlled state so that it's not like trying to run a marathon and you break off the plaques that's, and you have a situation with that. It is not that. It is very small, it's slow, easy moving. Tai Chi and Qigong are also some wonderful, wonderful exercises that is very fluid as you move. Very fluid. Okay? Simple yoga. You go into hug a tree like Pilates. Okay? And then you go into warrior, right? And snake and downward dog and cat stretch. These are very nice, soothing, easy exercises that you can do. And while you're stretching and getting these exercises in, you're toning your body, pulling that fat from between the fibers of your cells and helping yourself improve. Considering with HIV, a lot of people have gotten desensitized, I will say, with this illness because the medical advances have gotten so much that they have um, developed ways to stop the virus from reproducing and um, gotten titers down such that they're not detectable. But just keep in mind, even though you're on medication that does those things, you are also susceptible should you be weakened from some other illness. Let's say if you get a cold or a flu or one of the other viruses, respiratory viruses that are running around now. And this is fall, so it's about that time for those things to start rearing their ugly heads. These are the times when your immune system can weaken, and non-compliance with taking your medications can occur. So we want you to be sure to support your immune system with your food, with exercise. If you wish to take herbal supplements, you can. But again, please, please, please consult with an experienced herbalist, holistic practitioner, naturopaths, and your healthcare, your traditional medicine, conventional medicine providers before taking any herbs. Some will say don't take any. Use mostly the conventional medicine because they don't know how the most herbs support your body, and they're concerned with whether or not these herbs will interfere with or have an interaction with your medication that may either enhance it or suppress it. I'll put it that way, or be antagonistic, prevent it from working as well as it should. So, with that being said, and I want to thank you for joining me for this quick lookout. And I hope to talk to you soon. It's the weather here in the Houston metro area has broken. It is a beautiful day today. I now have overcast, but the sun was out earlier and it was an amazing day. And I will be out here more often now since it's easier for me to talk outside and see your smiling faces. Please put in the chat what you would like for me to talk about. My newsletter is coming out, and I will probably do another chat specifically on breast cancer next week and HIV infections the following week, and then we'll look to see what we're going to do for November. Thank you for joining me. I hope you have an amazing day, and if you would kindly like, subscribe, and share, I would love to reach more people. Um, I also would like, if possible, to subscribe to my YouTube channel. Come see me on Facebook. I'm also on Instagram, and I'm just starting to work out Threads. So, hope to see you soon. Have an amazing day and be blessed. See you next time.